We're now going to talk briefly about the digestion and absorption of lipids. So when we think about digestion of lipids, remember that most dietary lipids come in the form of triacylglycerols. So we'll have some as monoacylglycerols and some as and then we'll have some cholesterol and phospholipids, but the bulk of it is triacylglycerols. So I'm going to use this image to kind of talk through the different aspects of digestion of triacylglycerols. So digestion begins a little bit in the mouth, although it's very minor. So in the mouth, we have lingual lipase that is produced by the salivary glands. So this actually has the most importance in infants. So infant lingual lipase is quite high, and so they do more digestion in the mouth of lipids. And remembering that breast milk, which is the most natural source of nutrition for an infant, or formula, which is obviously a substitute for breast milk and tries to emulate it as closely as possible, would be high in fat content, and so this serves the infant well to have more lingual lipase. But that really declines as we age, and then there's really pretty minor digestion in the mouth. So you see here with that first arrow, the triacylglycerols will break down a little bit, maybe to some diacylglycerols and fatty acids, but not a whole lot going there. And on this side in the details for each of the steps, you see where the bonds are cleaved at each step. So then we move on to the stomach, where a little bit more digestion happens. Gastric lipase is produced in the stomach. And again, just kind of a reminder on nomenclature. Anytime you have that ACE, it means you're talking about an enzyme. And typically, the first part of it helps you determine what type of enzyme. So lipase is the lipid enzyme that's helped to break down the lipids. So there's some digestion there. But again, it's really not a lot that happens in the stomach. The vast majority of lipid digestion happens in the small intestine and primarily in the upper part of the jejunum. So there's a lot of nutrients that are absorbed, digested more in the ileum, in the duodenum, but lipids are a little bit more in the upper jejunum. So there's kind of two steps to the process for digestion of triacylglycerols. The first step is emulsification. And so remember that because enzymes are hydrophilic, they tend to interact in a aqueous environment, they're not going to interact well with a pure lipid. And so the lipid needs to be emulsified. And that happens primarily by bile. And remember that bile is released from the gallbladder. So our liver stores bile, but then the gallbladder releases that bile in response to the presence of lipid, really in response to the hormone cholecystokinin that is secreted in response to the lipids being present there in the small intestine. So that bile emulsifies the lipid, and then we go on to that second phase of digestion, which is the enzyme action on the triacylglycerol or diacylglycerol or fatty acids, but primarily, again, we're mostly still in triacylglycerols. And so pancreatic lipase is the key enzyme here. Pancreatic lipase is obviously produced in the pancreas and is released into the small intestine for digestion. Again, on this side over here, you can see more details of where the bonds are cleaved and what the beginning and end product are. So essentially, at the end of digestion, we end up with primarily monoacylglycerols and free fatty acids. There's actually very little free glycerol that goes into absorption. So kind of remembering our triacylglycerol has that glycerol backbone, and then those my fabulous drawing here, those three fatty acid chains. So essentially what happens is typically a couple of those fatty acid chains are cleaved to give you those free fatty acids floating around, and then there's generally a monoacylglycerol that's left, as opposed to all three of these fatty acid chains being cleaved and then having a free glycerol backbone. That doesn't happen so much. So this is kind of the basic process of digestion of triacylglycerols. One thing that I think is noteworthy, kind of a clinical application, is that the medication orlistat, which is also marketed as either Ali or Xenical, blocks this action of pancreatic lipase. So it doesn't allow that enzymatic digestion of fats. So essentially what happens with that medication is the body, it can become emulsified. So it gets to this stage here, but then it can't break it down with the enzyme. And so it excretes more of that fat in the feces. So that's kind of what happens to any undigested product in our digestive tract, if and whether it's carbohydrate, protein, fat, if anything doesn't happen sort of according to how it should in terms of digestion, it doesn't get broken down, then it can't be absorbed and transported, and so it just continues to move through the digestive tract. So in the case of a medication like orlistat, it blocks that pancreatic lipase and then causes more fat to be excreted in the feces. And anytime something goes through the digestive system without being absorbed, we don't get the calories or the nutrients from that. And so that's what promotes the weight loss with a medication like Xenical or orlistat. So, and it also produces some of the side effects, which can be oily stools. Some people kind of get cramping, that kind of thing, because of that lack of digestion. So in addition to triacylglycerols, we get cholesterol and some phospholipids through food. Of course, this is a much smaller amount than the triacylglycerols. But with cholesterol, the cholesterol has to be esterified in order to be digested, and then it undergoes hydrolysis to basically that free cholesterol and then a fatty acid, and that reaction uses the enzyme cholesterol esterase. In terms of phospholipids, lecithin is a common dietary phospholipid, and in that case, the C2 fatty acid of the lecithin is hydrolytically removed to produce two other compounds, one being a free fatty acid and the other lysolecithin, that then can be absorbed. So this is kind of the basic digestion of cholesterol and phospholipids. Doesn't require a whole lot of breakdown, just a little bit. So we kind of already talked about these first several steps. This image shows digestion and absorption together. So we talked about how the lipids come in and kind of get all the way to the point of being broken down into those free fatty acids and monoacylglycerols in the small intestine. So then the next step is the beginning of absorption. So those monoacylglycerols and free fatty acids have to move in to be digested and absorbed. They actually will move into the enterocytes inside, or I should say inside of the enterocytes of the small intestine. Those will sort of be repackaged so that they can move out and be transported. If it's a short chain fatty acid, it can actually go directly into the portal vein and toward the liver. And this is important because we hear about both short chain fatty acids and actually medium chain triglycerides we often hear of, or medium chain fatty acids that are absorbed differently. And sometimes they're used in patients who have fat malabsorption issues. And this is the reason for that, because they take less processing in order to get into circulation. So those short and to some extent medium chain fatty acids can move a little bit more directly into the liver, where the other components, so up here, number 6, the glycerol, glucose, cholesterol, and long chain fatty acids actually need to go into the enterocyte and have more processing. So they need to get sort of repackaged so that then they can be absorbed. Remember, again, it's all has to do with the fact that lipids are hydrophobic, and the blood is hydrophilic, so aqueous blood. So we need to have some way for the lipids to be transported around in that aqueous environment. So in the endoplasmic reticulum of the enterocyte is where that sort of repackaging and resynthesis happens that allows these lipids to then be transported out transported out into circulation. So really then the end product of digestion and absorption before transport starts is that chylomicron. So that's essentially the lipids, whatever kind of lipids needs to be there, packaged in this little micelle that then can start going through the transport process. So basically that sort of concludes digestion and basic absorption, and then we'll look at transport.